Now, during a visit by the Minister of Health to Huye District, where he visited the health infrastructure in the district hospital rather, the management of the hospital informed him of the challenges they face, including a shortage of doctors, as it often requires them to use part-time doctors from other hospitals, which they say has an impact on service delivery, and therefore call for more doctors to address the issue. Kabutare Hospital is the main hospital in Huye District. During a visit to the hospital this Sunday by the Minister of Health, Dr. Ngamije Daniel, some of the briefings he got by the hospital's director, Dr. Nzambimana Jean Bosco, included the issue of few doctors, citing that they have to work with part-time doctors who come in once in a while to support the few that the hospital has. The challenge is that we have few doctors, and we ask that we get more doctors to give proper care and service delivery. This affects the hospital's service delivery to those that seek services from the hospital, as well as the hospital's revenue, as explained by Dr. Jean Bosco Nzabimana. The impact is huge. For instance, a patient can come to seek treatment, and instead of spending 2 hours, they end up spending about 4 to 5 hours. Or they come to see a doctor and they won't see them at all. It also has an impact on the hospital revenue because we use the money we would have used to buy medicine to pay these part-time doctors we get from outside. People who seek medical services from this hospital say that the shortage of doctors affects them, such as the lack of proper follow-up care, as well as the delay in discharge from the hospital when they recover and want to return to their homes. The doctors are few. We ask that the number of doctors here be increased because there are times you call upon the doctor and they've gone to work on other patients. The challenge is that if someone falls ill, there's no one to admit us, as well as when the patient has recovered and there's no one to discharge us because the doctor is not around. The Minister of Health, Dr. Ngamije Daniel, says that as capacity becomes available, they are distributing medical specialists across, and that Kabutare Hospital will be considered. As the capacity increases in the Ministry of Health, as we get medical specialists, we shall distribute them across the country based on the number of doctors there. If the hospital has few, then we'll focus on these. So we shall consider Kabutare Hospital, and because it's near the Butare Teaching Hospital, we will consider of how, if there's a critical patient, they can get urgent care from there. But for it to also run smoothly, we will consider Kabutare Hospital as well to increase general doctors as well as experts. At present, Kabutare Hospital has 4 full-time doctors, where at least 15 doctors are needed for proper service delivery. During the visit, the Minister of Health also visited Butare University Teaching Hospital and inspected the reception facilities for suspected coronavirus patients and visited where those with the coronavirus infections will be screened.